Hello and welcome to Earthfile. I am Ayola Kasim as a signatory to the Basel Convention on Control of Transboundary Movements of Hazardous Waste and Disposal. Nigeria needs a national healthcare waste policy, guideline and strategic plan. At present, the country does not have a coordinated healthcare waste management system, especially in the areas of segregation, collection, storage, treatment and disposal. But the Federal Executive Council approved a new national healthcare waste management policy in September 2012, and a national steering committee that will ensure the effective implementation of this policy is expected soon. In the last few years, there has been growing controversy over the incineration of healthcare waste. Under some circumstances, including when wastes are incinerated at low temperature or when plastics that contain polyvinyl chloride are incinerated, dioxins and furans and other toxic air pollutants may be produced as emissions. Long-term low-level exposure of humans to dioxins and furans may lead to the impairment of the immune system, the impairment of the development of the nervous system, the endocrine system, and the reproductive functions. Short-term, high-level exposure may result in skin lesions and altered liver function.
Those wastes, if you don't do it properly, it will cause danger not only to the health of the workers, to the environment where they find themselves, and also the community at large. So it's a very small quantity of waste in the stream of waste that, if it is not properly managed, can be disastrous.
You know, the medical waste product, they contain a highly hazardous materials, and it can actually be they have a high level of contaminants. That there you have a lot of biodegradation that goes on right there, and if you burn them, they can actually be carcinogenic. You can be dispersing furan and dioxins. So, but when you take these organic materials, body tissues, blood, and the rest of them, the first thing to do is to get them stabilized.
The unsafe disposal of healthcare waste like contaminated syringes and needles poses public health risks. Contaminated needles and syringes represent a particular threat, as the failure to dispose of them safely may lead to dangerous recycling and repackaging, which lead to unsafe reuse. Contaminated injection equipment may be scavenged from waste areas and dump sites and either be reused or sold to be used again.
We have different categories of waste. We have the sharps, anything that can induce injury onto your body, like a puncture. Things like needle, scalpels, lancets, even broken vials. Those are classified as sharp objects, and they go into a sharp container. It could be in form of corrugated carton or plastic. Like we have samples there. We equally have blood products. These are highly infectious waste. We have blood products, blood and body fluids. Those one goes into the red bag. Then we have you can say infectious or less infectious, but if not taken care of properly, it can turn to infectious waste as well. Things like soiled cotton wool, soil bandages, your hand glove, discarded hand gloves, cotton wool, soil bandages, even infusion giving sets. We have all that one as less infectious waste. There are some other categories of this medical waste that we are not handling now. Things like radioactive waste, waste from X-ray. We are not getting such with them because most people want to keep their X-ray reports for some time. Until then, we are not getting that. But other forms of it, like the sharp ones, blood and blood products, and the bandages and cotton wools, we do get. And we have a treatment plan. The authority, the state government, through the authority, runs the treatment plans for medical waste. So in any facility, in any healthcare facility, we have the domestic waste operator and the medical waste operator managing the two waste, because we don't want them to come into contact. So the medical waste will be treated first before being disposed along with the domestic waste.
The quantity of medical waste generated daily in Nigeria is not only enormous, but the manner of disposal could be alarming due to the hazards associated with it. Healthcare waste has been a growing problem in Nigeria, as in many other developing countries and cities. Numerous studies show that before 2006 in Lagos State, 99% of healthcare wastes generated in the state could not be accounted for, suggesting that these wastes were generally mixed with domestic waste, illegally dumped, buried or burnt within hospital complexes, thus affecting the health of people and the environment.
Human activity generates quite a lot of waste, and the waste as varied as the components of the waste itself. We found out that initially when we started waste collection, especially in the communal areas, majority of the medical facility in there commingle their waste with the general waste, and so they expose our workers to risk. By the time you are even using your PPE to evacuate the waste, you could have injection injury, stick injury, and it could be disastrous. And especially in the prevalence period of HIV, when AIDS was paramount and the awareness was gaining ground that you will get contaminated by all those means, we decided to now take a closer look at the risk we have to expose our workers to.
We have different disposal material used to package them from the point of generation. We have the red bag for the highly infectious waste like blood, body parts, organs, tissue, and things like that. We have this red bag for the less infectious waste. Then the brown one for pharmaceutical waste, contaminated drugs, spilled drugs, you want to dispose it, but you don't want to use it again. We have that one for it. Then this one is for the sharp objects. It is puncture proof. We use this corrugated one because it is less costly. It's cost effective. There are some other ones that we can use. These are plastic container. They are also injection safety, puncture proof. The other ones can have this one within ward or this one by the bedside of a patient. So we expected that this bin liner goes into the corresponding bin within the facility. You may not necessarily have this color, but whatever color you are using, we expected that it will be coded. If you have blue color now, indicate that blue color is for less infectious waste. Purple color is for highly infectious waste. Then another color for pharmaceutical waste. You can code it if you don't have this color. This is the standardized color anyway by the World Health Organization. Even this materials, they are standardized one from the World Health Organization. So we use this green bin in Lagos for the domestic waste. So we expect that within the wards, you can have the smaller sizes of this bin placed around in the ward. Then at your dump point within the facility, you can equally have these sizes or those ones that are bigger than this. So that before the collector comes, you have somewhere that you can temporarily store your waste before collection for treatment.
Waste from healthcare facilities can pose risks to healthcare workers, patients and communities if not properly managed. There was a general lack of institutional waste management capacity at all levels in Lagos State until 7 years ago.
When you look at healthcare waste in Lagos, it's an integral part of waste management because of the importance of healthcare services in Lagos. Lagos is growing in population. The healthcare demand in Lagos is equally growing on a daily basis. You have an influx of everybody in Nigeria towards Lagos. And you have a lot of referrals even to Lagos these days. Hospitals outside Lagos State refer a lot of patients to Lagos right now. You need to get to Lasuth and see the large number of Nigerians that are there. And because of the policy of the state government not to refuse treatment for everybody. So the healthcare demand in Lagos is growing and growing, and I'm becoming afraid that are we not becoming victim of our own success in Lagos. But then that's another thing. But this healthcare service